National health insurance has already claimed the scalp of one minister and is yet to be fully implemented. NGOs, civil society organizations and health professionals have all spoken about the feasibility of the plan, with some doctors threatening to leave the country if it's fully implemented. The NHI is a financing system that's meant to pool together funds to provide personal health to the majority of South Africans. For more on this and the state of the health sector in South Africa, I'm joined in studio by Dr. Cindy Siwe van Sail. Thanks so much for your time on SABC News. What would the ideal implementation of national health insurance look like in a South African context?
So what we really want in Zinga is that we want everyone to access good health care the first time around. So an ideal NHI program would mean that wherever you are in South Africa, you should be able to go to any health facility and get the health care that you need. And that, unfortunately, is not what's happening at the moment. We don't have NHI implemented, but we don't have that health care for everyone happening the way it should be happening.
And what would need to happen to make sure that that would take place either in an NHI context or in a South African context right now?
You know, at the moment, the challenge with our health system is that it's an ICU, to use medical terms. The majority of people that access healthcare are accessing it in the public sector, and the resources aren't enough for everyone, right? And then a lot of people are still accessing medical care in the private sector, and they have lots of money for fewer people. So it's a bit of a topsy-turvy situation, and that's what we want to fix. That's what we want to remedy. So NHI is great on paper, I must say. It's a great bill, and I think it is a necessary one, but the implementation is always going to be the challenge.
Okay. HIV and AIDS is still a big medical issue in South Africa. It's one that you deal with quite a lot. How do you characterize the state of that education and treatment in South Africa at the moment?
So I always start by saying that our program is the biggest one on the continent, and we've done so well. We've made great strides if you compare it to where we were 10 years ago. The PMTCT program, preventing mothers giving birth to babies with HIV, has done really well. In terms of the stigma, that is still a problem. We're still not testing enough men, so not enough men are coming into the program, but generally we're doing okay. What we still have to do is, the knowledge around HIV. I spend so much time still teaching about HIV, and you'd think that by now people would know a lot of this stuff, but they actually don't. And so it's an ongoing challenge, teaching people about HIV, breaking the stigma, getting people to be comfortable with their statuses and to disclose their partners and so on.
You use social media a lot to speak about HIV and AIDS to do some of that education and knowledge dissemination that you're speaking about. How did that start and how is it now?
Well, it started in 2011. It started from a place of anger. So I'd come onto Twitter and complain about the things that weren't happening when I still worked, in the government sector. And then someone advised me to stop being so angry and rather use that platform to teach. So 8 years later, I'm still doing this, right? And it's helped a lot. I think a lot of people learn from my timeline. A lot of people have become more comfortable with their statuses, and they're able to make decisions about their health without necessarily having to see a medical doctor. And that's really what social media has helped us to do. It's helped us, doctors, share information with a whole lot of people, beyond borders. And that's important.
When it comes to the issue of dealing with healthcare challenges in South Africa, dealing with HIV and AIDS, besides money, there almost seems to be a need for a mindset change among most players.
So you know what it is? I think HIV has taken a bit of a back seat. We've forgotten about it. I think we're through the worst, so we're a bit more relaxed. We need to start speaking about it again. Right? We need to make the messaging around HIV fun again. We need to bring it back to the table so people don't forget that it still exists. And I say this, knowing that a lot of people feel that we spend too much time focusing on HIV. But if you look at the pandemic and what it has done, no other condition has wreaked the havoc that HIV has wreaked. And that's why I feel it's an important topic that should always be at the forefront of everyone's minds.
And then how do we package that topic without people getting bored of it, without people tuning out, or without a fear around that stigma that you've spoken about, or around the consequences of what happens if you are perhaps HIV positive?
I think success stories help. It's important for people to identify other people that are living with HIV, that are living happy lives. So I love it when people come onto social media and say, I'm living with HIV, I'm happy, I'm healthy, I'm living a full life. I love those success stories. And the packaging of the messaging also has to be fun. I try to make it fun. Short, punchy messaging that everyone can understand, which is fun. And I'm still working on it. It's getting better, but yeah, we're working on it.
As more people come into the healthcare space, as we've got more doctors and nurses graduating, it's always beautiful when we're seeing all these people graduating now and saying that they're doctors. Is there a need to re-look at the way that the health sector in South Africa functions? I know you've spoken about the use of social media, but with some things apparently it's still not allowed to, you're not allowed to refer people online. I found that out the hard way.
I remember that day.
So is there a need to change how that works, not only with social media, which might be an easier thing, but in terms of how public hospital works, perhaps how private hospitals work, and how the whole healthcare sector operates?
Well, you know, the internet has done so much for us. So I think South Africa is still lagging behind in terms of using the internet and social media for healthcare. And that's okay, right? Because the people at the top are probably from an era, a generation that doesn't understand how social media works. So it might not happen overnight, but obviously when people like myself and my age group take over, we're going to make sure that we use the internet and social media effectively within healthcare. I mean, I'm looking forward to a day when patients don't have to come and sit in front of me physically, where we can have a Skype consultation, right? Where we can consult over WhatsApp. I can't wait for that day, but it's not going to happen now because the people at the top are not ready for that. But we are going to make sure that that eventually happens, because it's not feasible for everyone to go and sit in front of a medical doctor or a nurse. That's a reality of life.
Then if I'm watching, how do I discern who's a proper doctor, who is someone who's going to give me advice? Because with the proliferation of information, there's also a lot of fake news. There's also a lot of people who are chancers.
It's up to us, the medical doctors, to out the fraudsters, right? So we've had a few situations online, and I also make sure that if someone comes online and says something that's not correct or not cool, I'm in their DM saying to them, listen, there is a protocol, because there is a telemedicine protocol. So we have rules and regulations that we work we work with. I mean, otherwise I'll be tweeting whatever I want to tweet, but I can't do that because I'll get into trouble. So HPCSA is very clear about what doctors can and cannot do online. And everybody knows this. So if someone comes online and they do something out of order, I make sure that, we call them out.
Thanks so much for your time on SABC News. Dr. Cindy van Zyl joining us in studio. They're talking about the state of healthcare in South Africa and social media. Time for us to take a look at the top stories we're following on the full